Welcome to the Power of One. Today, I am super excited to speak to Dr. Betsy Fitzgerald. She is a dermatologist and she's going to tell us all about our skin. I don't know about you, but when I turned a certain age, I noticed some changes with my skin and I don't want them. So maybe Dr. Betsy can tell me how to stay young and beautiful looking. Welcome to the show, Dr. Betsy.
Thank you. It's a pleasure.
Dr. Betsy, tell us, what is the primary goal? What is the focus for a dermatologist?
A dermatologist is a medical professional who's trained in the diagnosis, treatment, and health and well-being of hair, skin, and nails. So we encompass kind of a large number of different disorders, afflictions, concerns that may affect people's, like I said, hair, skin, and nails. It could encompass anything from acne, warts, hives, things like psoriasis, eczema, or atopic dermatitis, seborrhea, which is dandruff, also skin cancer and skin growths, such as moles and other growths on the skin. So we kind of encompass a large number of different concerns, but also all age groups.
And you know what? It never even dawned on me. The nails and the hair.
Yeah.
That never dawned on me. So with age, so I remember my oldest son, he'll be 30 this year. When he was a teen, like early on, when I tell you the pimples just came, we were like, wow.
Yeah.
And it all, went away. And like with me getting older, I'm noticing a difference in my skin. So age can play a very important role in your skin and what happens.
Yes, absolutely. So typically, we associate, like acne. We see acne, typically in like an adolescent population. About 85% of people between the ages of 12 to 25 will have some history of acne. So a large segment of the population. However, as we get older, certainly adult women especially may be greatly affected by acne and acne-like conditions, one of which is called rosacea. Also, as we get older, we start to see some other changes in our skin. As a teenager, with maybe if you did have acne-prone skin in your teen years, might have been oily, you might have had some blackheads associated with your breakouts. In adulthood, it may be a drier skin type, may be more sensitive. You might be seeing more discoloration from sun exposure, from genetics, from aging. So there's a series of things that we can see. And some of that may be actually, become more prevalent as we get even older, when we start to see more thinning of the skin and things like easy bruising, skin tearing, and things like that.
Well, I don't want it, so maybe you can tell me how to get rid of it. Now, tell me something else. I'm going to ask this is okay. So this show is just for me. Around a woman's menstrual cycle, can skin change? And okay, I get a couple hairs down here, and I'm like, oh my goodness, I'm about to grow a beard. I'm telling my husband, I'm going to need to shave with you. Talk a little bit about that.
Yeah. So our skin is under great hormonal influence. So I think that's why we see acne typically beginning around puberty. So what will happen is, as hormones become more active, they start to influence oil gland activity. So that leads to clogging of pores and breakouts. So we can see that a lot, in that teenage population, but also in adult women. So we can see that because of the hormonal changes during a menstrual cycle. And I ask every patient female patient I see about how their acne behaves, during their cycle. They see a very strong influence. It might be right around the time when they're starting to ovulate, but most women will know exactly when to anticipate the breakouts. So it is being driven by some hormonal changes in the skin. Also, we see that creating more hair growth. So we may actually see, as we get older, we start to lose hair on the scalp. You may start to lose hair on other parts of the body, but unfortunately, we may actually start to see more facial hair growth. Again,
Wow.
because of the hormonal influences, but now we also have great methods of manipulating the hormonal influence so we can treat the problems with hormonal acne, with facial hair growth, and or hair loss.
Hmm. Very, very interesting. So let's speak a little bit about skin cancer.
Mm-hmm.
How exactly does that happen? Is it being too exposed to the sun? And that's just me,
Mm-hmm. Yeah.
no textbook. And does it affect one race more than another? Like, does it affect African Americans less
Mm-hmm.
than it does
Yeah.
Caucasians?
So skin cancer is the most common cancer in the United States. So
Mm.
to give you an idea, 1 in 5 Americans are thought to be at risk for developing skin cancer. So on average, about 9,500 Americans will develop skin cancer per day. So
Mm.
the number one risk factor is sun exposure. So a lifetime of sun, and or frequent use of like a tanning salon, which can
Mm.
also create damage to the skin, increases the risk. The population most at risk would be a fair-skinned population because the lack of pigmentation means they don't have any natural protection from sun. So pigmentation acts as a protective mechanism. So anybody, I mean, certainly all races can be
Mm-hmm.
affected and
Mm-hmm.
all skin types by skin cancer. It just happens to be more common in a lighter skin population.
Okay.
What can happen too is skin cancer can look different on different skin types. So
Mm.
someone with a fair skin type, a skin cancer may look different than someone who has skin of color. So skin of
Okay.
color, it may look different. It might not look red and scabby. It just might look like a new dark spot or a little bit different than the other moles or freckles that the person may have. So that leads us to realize that we're trying to encourage everyone to check their own skin once a month to be aware of what they have and what location, and of course the areas they can see. Because we're finding that if persons are not being seen or are not checking areas like the palms of their hands, the soles of their feet, then they may develop a skin cancer that is further advanced at the time of diagnosis, and that may affect their overall outcome. So certainly a population with skin of color still is at risk for skin cancer, not as great as a fair skin type, but also because the skin cancer can look a little bit different, they may be diagnosed later in the course of treatment. So again, our job and a really big part of what we do is focusing on education, what to look for on the skin, how to protect ourselves from ultraviolet, so that we can reduce the risk for all skin types.
Is skin cancer 100% treatable?
It is just like any type of cancer. Early diagnosis is the key to successful treatment. So the vast majority of what we see, the different types of skin cancer, basal cell type, squamous cell type, and melanoma, which are the most common types, they are typically early. Early diagnosis is the key. And if we find them early, they are very treatable. Squamous cell type, if it's not treated, not diagnosed as early on, may behave a little bit more aggressively than a basal cell type. And a melanoma type, if it's not detected early, can be certainly more aggressive than both a basal and a squamous cell type. So across the board, early detection and treatment is the key.
How does one's diet play an important role in the health of their skin?
Yeah. Now, it's interesting. Of course, I think more, over time, we've read more and more about how diet impacts on our body overall. Poor diet, meaning that, something called a high glycemic diet, which relies a lot on processed foods and starches, things like white bread, snack foods, sugary drinks. Ingesting that diet regularly can increase inflammation in the body. So what we find is that inflammation seems to be the precursor to a lot of other health problems, including things like acne. So we're seeing that high glycemic diet besides creating problems like with hypertension, diabetes, and other inflammation in the body, it also can increase the risk for, acne. And
Mm.
overall, I think now that we've come to recognize more and more the importance of, eating, fresh fruits and vegetables if they're available, trying to decrease the amount of processed foods and these high sugary drinks. And it is interesting, cow's milk ingestion may be associated with an increased risk of acne. So
Mm.
it's an interesting piece that, some studies have shown us that, but
Mm-hmm.
it doesn't seem to be the case for some other dairy products. So it is something that we just need to kind of, when we're talking to an individual who has any type of acne, asking about diet and trying to encourage them to, just keep a diary of what they're eating, what they're drinking, so we can kind of discuss that and see if it might be really something we can manipulate.
Does the soaps we use, the detergents we
Mm-hmm.
use, the perfumes, does that play a part in how our skin stays healthy? Could those things break people out?
Yeah, so certainly across the board, skin as we get older, first of all, it tends to be more sensitive, a little bit drier, more easily irritated. Also, if we're treating an inflammatory condition like somebody who has acne, we
Mm-hmm.
want to decrease the possibility of creating further irritation. So, keeping skincare really simple seems to be the key for our health and well-being of our skin. So, what we tend to recommend is gentle cleansing. So, just like a simple, like a bar or a lotion cleanser, we try to avoid scrubbing and rubbing, astringents, toners, and other facial scrubs if somebody's already especially has sensitive skin or is dealing with an inflammatory skin condition. So certainly also with an older population, there's a myriad of skincare products that will, tell us that they're going to make us look 50 years younger, by just, purchasing it one product. But unfortunately, we have to be careful not to use multiple products because that can increase the risk of irritation. So
Mm-hmm.
simple cleansing, and we recommend products that you can find easily, like in CVS or Target or your supermarket. Also, sun protection. We know that sun is what increases the risk for skin cancer more than anything else. It's also what ages our skin tremendously. So it's a form of what we call extrinsic aging. So protecting ourselves from sun, and I recommend it for all skin types and for all ages, is really the key as well. So finding a product that you like to use, that it says that it's a broad spectrum sunblock with an ultraviolet of 30 or higher. And we recommend the reapplication every 2 hours or after you're swimming or sweating. Then, of course, if we're trying to reverse some of the signs of aging, we can always introduce products that have retinols or vitamin C. But across the board, to keep our skin well and healthy, just gentle cleansing, moisturization, and sun protection.
Doctor, talk about stress
Mm-hmm.
and how stress can affect one's skin.
Mm-hmm.
As you know, just as well as I know, stress can do a
Yes,
number on any and
absolutely.
everybody. But how can stress affect someone's skin?
So similarly, if we're treating somebody who has an inflammatory skin condition, so it could be their eczema or their atopic dermatitis, their acne, their psoriasis, we know that stress can obviously it can increase inflammation in the body by creating some other chemical changes. So now we're seeing that people who are going through a stressful period will say, around that, and I ask people all the time, like, what's going on at home, work, school? If it's exam time, some young people may really be struggling with their acne. Or, if there's some other things going on in the workplace, somebody's eczema or psoriasis may be flaring. So we do see a link with stress in a lot of these chronic inflammatory conditions that it may be creating more flares.
And hives, can that come from stress?
Hives usually are caused more often by something that's creating a hypersensitivity.
Mm,
So it's something that more often we think it's something creating this sensitivity, be it a food, something in the environment, like an airborne,
mm,
something you ingested, or also like an underlying medical condition can
mm.
create by creating this inflammation in the skin. Could it be somebody's thyroid? Could it be something else that is creating this a hive? So a hive can be a marker for typically something else going on.
Understood. Well, I mean, this has been an amazing conversation because you don't know, like, and I know a lot of people don't know all the things that dermatology they
Mm-hmm.
specialize in, which is awesome. Now, the dermatologist, now speak about like the hair
Mm-hmm.
and the nails.
Yeah,
So speak a little bit more
sure.
about that and how a
Yeah,
dermatologist comes into play with those two
sure.
aspects.
And hair disorders are something we deal with very frequently in the office. At the end of the day, any form of hair loss can be incredibly traumatic and very
Mhm,
difficult to
mhm,
live with. So there's many different reasons for hair loss. It could be due to, our aging process and hormones. What's really interesting is we can see it after an event in our lives. So,
mm,
after childbirth, after surgery, after hospitalization,
mm.
many people can go through an exaggerated shedding period where suddenly they start to lose their hair. Interesting, post COVID, we saw a lot of that shedding phenomenon.
Really?
It's called telogen effluvium. That we've known about it for years. We know what questions to ask, but interesting that as COVID became more commonly seen in the ambulatory population, we were seeing more people come in with this form of hair loss, and
Wow.
only asking like historically what has happened. Many people, it would occur like roughly sometimes a few months post COVID infection. Now, that type of hair loss is short lived and will
Mhm,
rebound and recover. Now, there are other very common forms of hair loss that could be due to what we call an autoimmune phenomenon called auto
mhm,
alopecia areata, where
mhm,
young, otherwise healthy people may start to lose hair. There can be inflammation in the scalp created by something called centrifugal cicatricial alopecia, where people start to lose their hair from traction, from wearing like hairstyles, for an extended period. So there's many reasons for hair loss. So when we see somebody who's suffering from it, we do a thorough history, look at medications also because medicines can do it,
mm,
underlying
mhm,
medical problems, and again, inflammation on the scalp. So very commonly, we'll do actually a biopsy of the scalp. So a
mhm.
pathologist can look at the hair follicles and give us an idea of why they're, what's going on at the hair follicle level so we can taper treatment.
Now, what about the nails?
Yeah, so the nails, there's many different conditions affecting nails. It can be due to infection. So,
Mm,
fungal infections are not uncommon, affecting like nails on hands and feet. So that's something that we can treat using oral agents or agents that are applied directly to the nail. There can also be nail breakage disorders, which can also happen as we get older, as the nail plate itself starts to thin. It can start to ridge and can start to split and crack. So there are excellent treatments for that as well. There's also skin growths that can occur under the nail plate, affecting the nail bed. So that is
mhm,
something that can appear as suddenly a darkening of a nail. So
mhm.
when we do somebody's skin exam, we always look at the nails too to detect to see if there's any discoloration that is new or different, because that too may warrant a biopsy and could signal that there's a skin cancer affecting the nail plate.
I want to thank you so much for all of the education today. And thank you for breaking it down so that we all understand. Thank you so much, Dr. Betsy.
That was a pleasure.
Thank you so much for joining me today. What a wonderful conversation. We have to continue to do what we know is right, eat right, and go see your dermatologist so we can stay looking young and beautiful. Peace and love.